Well, after industry-wide shutdowns as a result of coronavirus, the Department of Health are now looking into any measures they can come up with to help manage the expected crisis load on our nation's hospitals, including transforming hotel rooms into quarantine zones and makeshift hospitals. Michael Johnson is the CEO of Tourism Accommodation Australia. He joins me now live from Sydney. Thank you for your time tonight. I really wanted to give people a sense of a couple of things. The expected load we have on our hospitals coming forward with coronavirus pretty much over the next 3 to 4 weeks ongoing, but also I think the willingness of your sector to really step up and provide solutions. We're seeing this with business right around the country, but in particular accommodation. Let's start at the beginning. There's talk about hospitals taking away from their own beds there the non-coronavirus patients, so those not infected, they might be in there for other reasons, and perhaps putting them inside hotels so that frees up those beds for this expected onslaught of coronavirus clients. How would that work, and is the sector willing to do it?
Well, Peter, it's something that we've actually participated in for some time, and it's something that has been experienced by particularly second and third time mothers, where they actually would have the baby and then go into a hotel to convalesce, hand the other children off to husband, and then convalesce in the comfort of a hotel room. And that's how we see this working. We actually see the hospitals actually identifying those patients that have gone through the hard time already in hospital, and they're just ready to do the last part of their convalescing, and so that would then happen in the hospital, in the actual hotels themselves, and they would dedicate floors and dedicate the necessary medical staff to convert. And it's at a time, of course, when we know that hotels' occupancies are extremely low, and the anticipation is that the hospitals will require the space. So it's a really good match, actually.
Yeah, I think it's a great match. I have visited people in hotels where they have come home from maternity wings, you're right, and there's usually a nurse's station created on the floor, so the people aren't just there in their rooms, they have access to medical care. There is a level of sort of step down from hospital care before they end up going home. But you're right, this could solve the government a big problem, particularly look at the issue of New South Wales, where they've had such a steep climb in the last week in terms of coronavirus infections. What about taking on people who are supposed to self-isolate, but they perhaps are in a home or a house with others who are not at risk, and by going back to self-isolate in a shared house, of course, they're putting everybody in that house at risk, or perhaps medical people who fear they've had some level of contact with coronavirus. They've not yet tested positive, but they need somewhere to self-isolate and not, a husband and wife, let's say they work in medicine, you can't take two of them out. Is that something you'd be prepared to do?
Well, I can honestly say it's something that's happening already. We're seeing a lot of our hotels in the cities right around the country have got people self-isolating now. It's the hotel staff are certainly geared up to be able to do it, and they do. They have floors set aside for self-isolation. That means that the staff actually know which rooms they're in, and then they take the necessary care that everything that's delivered is delivered to the door with a knock on the door. Everything's then taken away, specially bagged for linen, etc. Linen's brought to the room. These things are happening as we speak, and happening successfully. And I think, again, that can continue, but there will be a certain amount of time, you think, once lapses, that there won't be the need for self-isolation, because we'll pretty much have all borders locked down, and that'll be the end of it. But I think more to the point, as the virus continues to grow, hospital beds will become in short supply, and that's where the hotels can certainly participate. And I think it's not just CBD-wide either. As you know, Tourism Accommodation Australia is part of the Australian Hotels Association. We've got accommodation all around the country in locations such as Dubbo, and if you think about any of those regional areas where people could find themselves sick, in those regional hospitals and then find themselves doing you know what I mean, last parts of recuperation in those hotels.
And what's been the response? Have you had any conversations with government at either state or federal level as an industry?
Certainly with the Department of Health, yes, and it's more state-based. I think it's something that the federal government's looking to achieve, but of course it'll be run out through the states. So certainly we've been speaking to and liaising with the Department of Health in both Victoria, New South Wales, Western Australia. You will have seen the Premier yesterday, day before, advising, liaising with Rottnest Island to utilise Rottnest Island for quarantine as well. So yeah, in actual fact, there's a lot of communication going on now, and I think it's probably ideal to be happening now before we're actually right in the thick of the problem. Let's get organised.
Yeah, well,
let's get hotels.
Let's get organised. I think it's about to hit. I think let's get organised, Michael Johnson. I'm 100% behind that. I'll have to leave it there, but thank you very much for your time.